what's going to happen tonight. I would first like to welcome you to our session on understanding music therapy. For those of you who don't know us, we're the Connecticut Parent Advocacy Center. We're Connecticut's Parent Training and Information Center under the Individuals with Disabilities Education Act. And our vision, for those of you who don't know us, is that all families will have the confidence, knowledge, and understanding they need to effectively advocate for their children and to partner with professionals to ensure children and youth grow and learn to their full potential. It is with that in mind that we bring you this Best Practices in Education series. I want to do a few housekeeping things. Because this is a public session and because we are recording, we wanted to remind folks that you might want to be thoughtful about anything you might disclose about your child's personal, your family or your child's personal information. We'd like folks to keep this more to a group kind of conversation and a little less personal. If you do have personal questions, CPAC is available to take your calls and to help direct you to the right resources. You can contact us at 860-739-3089, and we will talk to you very specifically about your individual questions. We also have a comprehensive website, www.cpacinc.org, or you can email us at cpac@cpacinc.org. That's probably a better way to have private conversations, but for tonight, we'd like to really learn from Courtney, who's our guest. So I think there's one other thing I need to announce, which is please remember that we are not lawyers and we are not representing legal advice here tonight. So on that note, I'd like to introduce our guest, Courtney Biddle, who is our music therapist from Progressions Music Therapy. Is that right, Courtney?
Yes.
Great. So if you'd like to help us understand who you are and what we're going to do tonight.
Absolutely. Well, thank you so much for inviting me here tonight. I always like to tell people I'm a really informal presenter. So if you have questions or anything like that, please don't hesitate to ask. And you don't have to wait till the end to ask, because if you're like me, you'll probably forget what it was at the end. So we're going to talk about music therapy and then also specifically about music therapy in the schools. So music therapy, I'm a board certified music therapist. I've been practicing since 2004. I received my undergraduate degree from the College of Worcester in Ohio and my master's degree in music therapy from Temple University in Philadelphia. The real short definition of what I do as a music therapist is that I use music to achieve non-musical goals. And so what that looks like is really individualized for each particular client that I work with. We work on communication, cognitive, motor, emotional, and social skills. And there are a lot of different nuances that go into what we do. So I'm going to, kind of continue to explain what it is that we do as music therapists. I'm going to share my screen here with you, and I've got some slides and to kind of go through what we're talking about here. So, all right, can everybody see that? All right.
Yes, thank you.
Wonderful.
Yes.
Okay. So music therapy. What is music therapy, first of all? It's an established health profession. We work with all ages and ability levels. We work all the way from birth through death. But we focus on achieving non-musical goals, like I said, communication, academic, cognitive, motor, and emotional goals through the music. You don't have to be musical to be successful in music therapy. And one of the things that I really love about music therapy is that we can make anybody be successful in music therapy. I work with a lot of children who have a lot of needs, and we're still able to add success into their day, which is, super important. So, we work on many different goal areas at the same time. So one of the things that I like to talk about is in a say in a preschool setting, I might have children sitting in a circle. Now this is in a, you know, in a typical year. I might be working with children and we're sitting in a circle and everyone gets an instrument and we play a song and then we pass the instrument to the right. And then we play a song and then we pass the instrument to the right. We're working on fine motor skills. We're working on gross motor skills. We're working on saying thank you when your friend gives you an instrument. We're working on sharing. We're working on giving up that instrument that you really wanted or waiting for that instrument that you really wanted. Sometimes we are singing songs where only the red instruments play or only the blue instruments play. So there's a lot of different things that we do just with that one particular intervention. Music therapy is a related service under IDEA. So I think that's also really important that, you know, in the school setting, that's not always something that when a child comes in there, a lot of them are offered speech therapy, occupational therapy. Music therapy isn't something that schools will tend to offer unless parents ask for that. We provide music therapy in group or individual sessions, and it's highly individualized to meet the needs of each child. So we really take a look at what's on the child's IEP and make sure that we are able to meet those needs. So this is a big one. Who's qualified to be a music therapist? We have to have at least a bachelor's degree in music therapy, which includes 1,200 clinical training hours. So most of the time after you finish your degree, you have a 6-month internship. Most of them are unpaid. I was lucky that I got paid in day-old bread from the local Costco. So that was something that was a perk, I guess, in my internship. After you complete your degree and your clinical training, you have to pass the board certification exam and hold the credential of MTBC, which is Music Therapist Board Certified. So if you are looking for a music therapist, they have to have that MTBC behind their names. In the state of Connecticut in 2016, there was a law that was passed that provided title protection for music therapists. So if somebody says that they're doing music therapy and they don't have a degree, they don't have that MTBC behind their name, it's a Class D felony. So we want to make sure that we are protecting the folks that we're working with. And then also we have to complete at least 100 hours of continuing education every 5 years. So that gives you a little bit about what, you know, is our qualifications. In school, we have to take music theory, music history. We have to be proficient in guitar, piano, voice, percussion, whatever our major instrument is. Mine happened to be trumpet. I had to take 6 weeks of every instrument, every, you know, major orchestral instrument. So there's a lot of psychology and sociology as well as our clinical training hours. All right, so how does music therapy work in the public schools? First of all, I'm going to ask, and I can't see everybody because you're looking at my screen, but are there any questions so far?
Not yet on the chat.
Okay, great.
In the chat. We'll keep an eye and let you know, Courtney, if somebody has a question.
Perfect, thank you. So how does music therapy work in the public schools? So, as I mentioned, music therapy is a related service under IDEA. Getting it into the public schools can definitely be a different type of a process. As I said, you know, most schools will have a SLP, an OT, a PT that work in the district. With music therapists, we're more likely at this point in Connecticut to contract with many different districts because they might have 1 or 2 students that will, you know, qualify for music therapy. So the process goes through parent, guardian, other team member identifies a child as possibly needing music therapy services, especially if that child is not progressing in goal areas with other types of therapies and interventions. So we see this a lot where, I get contacted by a parent who says, my child really isn't making very much progress with speech or OT or in their classroom work, but they love music. And so is this something that we can work on? And so my answer is always, let's see if we can get the school to have an assessment. So what we do then is that, usually a PPT is held. An assessment will determine if your child would benefit from music therapy, does not benefits from, and requires music therapy services. And we'll get into those kind of specific categories here in a little bit. But that's what our assessment's going to determine.
Courtney, can I interrupt you?
Absolutely.
Are you going to get into what that assessment looks like a little bit?
Yes, absolutely.
Okay.
Yes. And then if we do find that the child is going to have music therapy on their IEP, it's going to be determined if these services are going to be group, individual, or a combination of the two. So this is our assessment that we use when we, this is the assessment that I use and that many music therapists. You might find a music therapist who would use a different procedure, but this is what I use, is called the SEMTAP, or the Special Education Music Therapy Assessment Process, and that's going to help to determine eligibility. So it's a pretty rigorous process. It typically takes me about an average of 8 to 10 hours to complete everything. So what we start with is conducting interviews with the students, family, teachers, other service providers, and the child also, if possible. We talk about what the strengths and what the needs are of the child. What is their reaction to music? Because we know that a lot of teachers are already using music in a circle time, or they might use music in helping to learn different concepts. Think about your alphabet song, something like that. So we start by talking about what those things are, and then I will review the IEP reports, other documentation. So, kind of getting a little bit of a written idea about how this child presents in their setting, at their school setting. Then I'm going to go in and I'm going to observe their child in their classroom settings or other therapy settings. So I'm just going to be an observer, and I'm going to look at, I'm going to ask the teacher usually, can you do something? Can I observe something where they're maybe doing something with music versus maybe doing just a classroom lesson or something like that? Then I'll go back and look at the IEP and say, okay, here are these couple of goals that I'm, seeing that they're having a harder time with. Typically, but not always, it's a communication type goals or social goals that I'm looking at. But again, we are qualified to work through all the different goals that might be part of an IEP. So then I will make these sessions, and usually I try to do 2 or 3 sessions for music therapy, because we all know that so many of the kids that we work with, trying to do a one-off session doesn't always work for them, because it's, getting to know a new person, things like that. Then I'm going to write my report and present my findings to the team. And so there's like I said, there's a lot of different steps that go through there, but it is a process where we basically are looking at, how does the child focus? How does the child interact when there's music present, when there's music therapy present, and when there's no music present? And so looking at how they are, being able to interact and achieve their goals. All right, so we're going to go to the assessment results. So what our assessment can determine is the child would not benefit from music therapy. We find that maybe about 5% of kids would not benefit from music therapy. I'm looking at their scores are going to be lower in music therapy than in the classroom or other settings. So that would be, I'm not going to recommend music therapy for that child. The second one is that they would benefit from music therapy. So what I'm looking at there is if a child is completing a goal at 50% in the classroom setting, and they are completing that goal at 51% in music therapy or 55% in music therapy, I'm going to say that, yeah, absolutely, they would benefit from music therapy. Um, and then there's the probably about 90% of kids are going to fall into this category, at least in my personal experience. Their scores are the same or minimally higher. Then the last category is our other 5%, where these children require music therapy. So the scores were much higher than in the classroom or other therapy settings, and it's not unusual if we get to this assessment stage. It's not unusual for our students to say they might be meeting their goal at 50% in the classroom, but maybe 75% in music therapy. There's no real cutoff. It really depends on sort of the school district, because it kind of goes back to that. If they get real technical, if a child is if their goal is that they're going to meet something at, I just like using 50% because it's easy for me to remember. If they're going to meet something at 50% and they're meeting it at 50.1%, then technically they are meeting that goal. So I've had school districts who have been real technical about that and say, well, they're actually meeting their goal, so I don't know that we need music therapy. Some schools are, they're like, oh yeah, they met it at 52%, so let's provide this service. Other times it's like, oh, well, you've got 75% versus 50%, and let's do some more assessment sessions to see if it's still the same. So it's there's no real like hard and fast numbers about where the requirement goes. It definitely has to do with all of the parts of the assessment. So then what happens after the assessment, as I said, if the child is found to require music therapy services, the school district must provide these services. They must provide them by an MTBC. A lot of times we will hear, well, the child likes music, so we can put them into another music class every week because they love going to music class. And that's lovely and wonderful, but music education is not music therapy. The analogy that I've heard about that, it's sort of like asking your gym teacher to be a physical therapist, right? They're both super important, but a gym teacher isn't qualified to be a physical therapist any more than a physical therapist is qualified to be your phys ed teacher. So we want to make sure that when we're advocating for these services, that we say, that it is being carried out by a board certified music therapist. And then the music therapist is going to determine what type of services the child will need and plan these sessions accordingly. And so, one of the things about what we do is we can, provide the pull out services or the push in services, which I think the next slide talks a little bit more about that. There we go. So types of music therapy in the school. So we've got direct services. These are written on the IEP, just as your educational classroom goals are, just as your OT, PT, speech goals are written on the IEP. A student may receive pull-out or push-in services, individual or group. And so what that kind of looks like is that I might go and pull a student out so that I can see them individually. A lot of times what happens, as I said, we get called in for communication and social type of goals. And so we can work on those communications in an individual setting. We can work on the social goals with a group of students. And we've done everything from, in their self-contained classrooms with maybe a couple of other students. Maybe the child has a harder time in larger groups. And so we might go into their whole classroom, and the child might go into a mainstream classroom, and we have a session there. I've had sessions in the cafeteria, because that's a hard place for people to go into because it's noisy and there's different acoustics. And so the child might love music therapy, and we're having this successful experience in the cafeteria or in the gym with a child, and that helps them to sort of build on those other successful experiences. And then I always like to talk about, even if a student is in a group, when they're receiving direct IEP sessions, every child in that group is going to benefit from what we're doing. But my goals, my objectives, my interventions that I'm working on are specifically directed toward the child that I'm working on the IEP with. So that's our direct service model. Educational enrichment, which is also provided by a school district. And this is where we don't go through that whole assessment. They might say, hey, we have a group of preschoolers that we need a music therapy setting for, or we have a neurodiverse middle school room. Can you provide services for the whole group? And so those things, we're looking at general group goals, those participation. Certainly if something comes up with one of the students, I will tailor individual interventions to help meet their needs. But that's more of everybody's goals get worked on in that. In consultation, and this can be provided on its own or with other, consultation as well as direct services model also. So it's when I'm there, I'm providing ideas, resources, and supplies for the classroom teacher or other professionals to carry out. So that means that I am looking at what are some things that this student can do in between the 1 or 2 times that I'm coming every week? What kind of songs are they really love that song that I wrote, so that I might make a recording of that song. So that's something that they can use even if I'm not there. And so those are the different types of models that we have in the school setting.
Can I ask you a question about educational enrichment?
Absolutely.
So I have never heard that before. I definitely know families that have it on individual IEPs, but I've never heard it used in a group setting. So when you talked about that people are working on the group, that the folks in the classroom, whether they're preschoolers or middle schoolers, are working on kind of group. So do you see that as kids with maybe social skills needs, that you're helping them to take turns? And what other kinds of things might you work on in a group?
So absolutely, there are those social type of things. In a lot of the educational enrichment programs that we've been in, it's like a typical integrated preschool. So we're working on, for the younger kids, it's more of those PreAcademic concepts, sitting in a chair and participating and those kind of things. And of course, if the teacher says, hey, Miss Courtney, we're working on farm animals this week, so we're going to pull out some different things that can fit in with their academic theme as well. For my older students, it's the same, those participation, those, self-esteem. So many, so a lot of the time, the students that I see, have different struggles in different ways in their day, whether it's having a hard time going to the cafeteria, or whether it's having a hard time being in the same room with one other person, or anything like that. And so those are all things that we would work on in a group. The teachers in typically in educational enrichment, I'm not privy to the IEPs because I'm not necessarily considered a team member. So I don't really have the saying like, little Susie needs to work on, enunciating the ending of her words. So I don't get that. But what I will get from the teachers is saying, hey, Susie and Johnny had a fight today. Can you work on something that will help them to understand their anger issues, or something like that. So a lot of times it is also working on those emotional goals of how can we feel good about about ourselves? How can we feel good about what we're doing?
Thank you.
Mm-hmm. Yeah, I see.
It looks like Diane has a question. Go ahead and unmute yourself, Diane.
You muted, Diana.
Diane, you're still muted.
I apologize. Sorry.
It's okay.
I am a special education teacher, and I've worked with 4 to 21-year-olds, and I am also a musician.
Mm-hmm.
And I know that we had one student that came in that said music was on their IEP. He said, "No, I am not a music therapist. I refuse to do anything with that. I will help. I will have, but don't claim me as a music therapist." Do you have specific songs, like when you say, for self-esteem, or do you write your own songs? Like, I know I have written social circle songs.
Mm-hmm.
I have written songs for kids to remember their names and addresses and things. But when you get into like a fight and something like this, let's talk it out. Yes, in the classroom setting, you can talk it out, but how would you use music therapy in that point?
Sure. That's a wonderful question. And first of all, I appreciate your advocacy so much. And I love that you're using music in your classroom. I always say, like, we don't own music as music therapists. We want to see our colleagues using music. So for something like that, I might not even use a song. I might use more of an improvisation where, we have these two students who come pick out what instrument you want. They might pick a drum or they might pick something else. I love the hand drums. Those are so great for sensory feedback and everything else. And so, okay, well, this might be more of a type of a resolution that you would use between the two students who might have had problems with each other, rather than just in a whole group. So you might say, so when they did this, how did that make you feel? And maybe they don't have the words for it or whatever. And, oh, I'm going to just, really play that drum. It made me feel angry. And then, okay, then when they did this, how did that make you feel? And, oh, that made me feel angry. Okay. So we know it's okay to feel angry. Absolutely. Play your anger, play those drums, play those instruments as much as you need to. And then, okay, so how do we go from feeling, we don't want to stay angry, right? That doesn't feel good to stay angry. So how do we go from feeling angry to feeling better? And so that might be, again, using those instruments. How can you play a way that would make you feel better? Does this rhythm make you feel better? Does this thing make you feel better? Because I think sometimes when those real heightened emotions get in there, there's certainly songs that, you could use. And I write my own songs. I do a lot of improvisation on the spot of how, like I might sing and play, and okay, so they said, you made me feel angry, and I'm gonna play about that, and I'm gonna match my music to playing angry, and then I'm gonna take my, it's usually my guitar, I'm gonna take my guitar and I'm gonna start playing a little bit calmer, because we all know when kids are feeling angry and you say calm down, that doesn't really do anything for them. But when I'm sorry, I'm gonna scooch myself back. I'm sitting at my kitchen table and I'm in the sunshine. It's like glaring in my in my eyes. So yeah, being able to say, giving them that, I think what music really does is it gives us that, like, okay, this is exactly how my body's feeling. For some students, depending upon where they are, doing a lyric analysis of, finding a song that might represent, I'm angry because you did this. And it might be something that you've written or something that you found that would work for them. And having them read the lyrics and say, oh man, I know how that person feels. I get why they wrote that. Because it's a projection. They're projecting, it's a little safer for people to sometimes say, oh, well, the singer felt this way or the musician felt that way, rather than, well, I feel this way, even though we know that it's really how they're feeling. So I hope that helps.
Oh, tremendously. Thank you.
Good, you're welcome. Yeah, and I think just being able to, sometimes we want to solve the things with words in a song, and I'm projecting here now too, but sometimes those instrumental things, and it doesn't just have to be, you know, classical music. It can be, but sometimes it might be a rap beat or something like that, where you can
Yeah.
find one that you feel angry. And a lot of the work that I do at the current moment, I work with a lot of kids with trauma. Um, and so we've been working on making playlists. And so we make these playlists where they say, okay, I'm feeling angry, but I don't want to feel angry. I'm starting here, and then I'm going to go down to here. And I always tell the kids, it's really important, make those first couple of songs angry songs, because you're telling your body, this is how I feel, because you don't want to just say, I'm angry, and throw in like a super calming song, because you're not giving them that autonomy of saying, like, it's okay to feel angry. This is something that we can do with it, with that, making that playlist. And then gradually your songs are going to get less angry and less angry. But I always liken it to, if I'm angry and somebody tries to like give me a super calm song, it's almost like throwing a glass of ice water on me, right? And that doesn't feel good, and that doesn't show our kids that it's okay to feel that way. It's just, you know, I always tell people, it's like, it's okay to have these emotions, but then that, what do we do with it, you know? And so you're modeling that for them.
That's great. Does anybody else have any questions? I'm also curious if anyone else is an educator, if you have experience with music therapy in your school. And Diane, you're welcome to comment if you have had experience with any music therapists in your experience as a teacher.
No, actually, I have not. There was a music therapist at the school that I am at now before I came. And, but no, I've usually just taken over from other musicians that have been in the schools or whatever. And just, you know, especially I like working with the SLPs, because to get the students to pronounce words and put endings on words, like you said before, Courtney, you know, that's what I work on individually with kids, because I know that they need it. You know, being in the classroom with them, I also teach health, believe it or not. So being in an actual classroom with them and see how they react and how they speak, I can, you know, we have a rock band, we have, you know, different, like a folk group also that's in the school. So the kids get a chance to see and to work with that also, to see how they can express themselves. They write their own songs too. We've gotten them to write their own songs.
Love that. That's amazing.
That is great.
Yeah, absolutely. And Diane, I know you mentioned working with SLPs, and that is, again, something that is so near and dear to my heart. I've learned so much from my SLP colleagues. And, you know, one of the reasons why music therapy works for so many kids is that we process music in the brain differently than we do anything else. So when we have a speech part of our brain and we have a song part of our brain. So I've worked with people with neurological impairments, people who've had strokes, who might not be able to speak anymore, but they can sing.
Yeah.
And it's incredible. And it's one of those things, if I sing do, re, mi, fa, sol, la, ti, right? What do you want me to do? Everybody's like, oh my goodness, finish it, do, right? And it's the same thing, you know, with so many of the kids that I work with, whether they can react in a verbal way to that, whether they react by eye widening, body movements, anything like that, they're able to access that to say, oh, I know that I need to finish that, or she's just going to hang out on that note all day, and it's gonna be like, that doesn't sound right, that doesn't feel right. And so there's a lot of different things like that in music. I'm a little bit of a brain research nerd when it comes to music. And so music is the only thing that we do that uses both sides of the brain at the same time. It goes across that big bundle of nerves, the corpus callosum in our brain. And so I think it's really incredible. And in my experience, and I'm very passionate about what I do. I love being a music therapist. I love being able to go into schools and other settings and work with folks who, the teachers or the parents are saying, man, this is, we're really having a hard time with this. And then I can come in, not always, it's never a guarantee, but to say, oh, this is something that they're having a hard time with. Let's work on this, and then we see a great improvement in this child's life, in the family's life. And it's because of the music and because of the way that we're really able to make things very individualized.
I just want to share that I have a family member who is now an adult who at the age of 2 and 3 had no language and screamed at everything that came in her way all the time. That was her functional level. And now she's a college graduate who works on a news team because music therapy really impacted her life in a very big way. It really allowed her to communicate and then learn once she was able to communicate. So I've never had it for my child or been present for it, but I've seen it really transform a person. And I know that that's not what it does for everyone, but have you had experience like that?
Absolutely. And I think one of the other things that I love about what music does in our brain, there was a study several years ago, specifically on autistic folks, where they found that music creates new neural pathways. So for people who might have some, blockage about where the speech is coming from, the same thing with Gabby Giffords, the representative who had the traumatic brain injury from a gunshot wound. She sang before she spoke. She received music therapy in the hospital. And so, again, everybody's brains are so different, but this is something that can definitely help create those new neural pathways. And it's something where, being able to hear from parents. I just heard from a parent the other day, my child got into college. And this was, I get a little emotional because of, knowing where those kids came from. And those of you who are educators, like, you get it, you understand. Or, my child went from, not saying maybe one word at a time. It was a one word demand to, can I have the drum, please? Can I have chicken nuggets, please? Can I have this, please? And those kind of things are certainly something that we look for and that we can work on. And of course, it doesn't all have to be verbal. That's one of the things that I love about music, is that, we've used a lot of different, we work with kids who come in with their talkers. They come in with their communication devices. We work with students who use sign language. So all of those types of communication are also involved in what we do. And as I was saying with Diane, so much of what we can do can be nonverbal, that we don't need to rely on some of that for folks that's a little harder for.
Hi, my name is Margaret. How's everybody?
Oh, good, Margaret.
Great. Hi, Margaret. How are you?
Well, I am wonderful. It's so amazing to hear all this, because I will tell you a true story. My daughter went to school, to a music and art school, and she discovered that she loved music. And lo and behold, she decided music therapy is what she wanted to do. And if I tell you, like, when I tell people that she's a music therapist, the first thing is, oh, she plays instruments. And nobody understands the art of music therapy. And I find myself, propping her up and saying, do you understand what it is that she does? And when she does her sessions, and I'm at awe just to watch her, how she can take someone who doesn't speak at all and they can communicate. And I as a parent, you are so proud to know that they take a skill and they develop it, and it's for the benefit of someone else. I mean, she's so into it that with my dad.
Oops, Margaret, you muted yourself.
Yeah, she's taught him how to communicate with her. She even taught him how to play dominoes again, and he's visually impaired. And
wow.
she uses the skills that she learns as a music therapist to reach people who can't communicate, who can't give you how am I feeling today. what do I want today? And to hear you guys, and I'm almost in tears going like, this is special. This is amazing that, you bring that to the table, where years ago when they said music therapist, they're like, what is that? So, I'm glad to join. Like when I saw the posting, I'm like, I have to join this because I know exactly what it is to be on both sides, where I have a child and I have a parent that needs it. And it's amazing. I can't even say more than how much we appreciate all the music therapists and all that they do for children, adults, you name it,
Margaret, it's great for you to, it's wonderful for you to join us. And you actually made a great point about a while ago, nobody knew what music therapy was. And oftentimes in our office, we would get parents who were told it's not evidence-based. And that's one of the reasons we brought Courtney on, was to share that there is actually an evidence base. I know Vanessa did you want to ask a question, Vanessa, or did someone have one for us?
I just want to share that I have my own experience with the music too. My son's on the spectrum and he couldn't say a full sentence, but he could sing a full song when he was younger. I'm like, how can he sing the whole song? He was very good about the ups and downs on the music. And I have a couple of little videos sometimes comes back to me in my phone. And I'm like, wow, he could sing very well, but he couldn't ask me, can I have water or I want more? So the music was the first thing that came up to, the language for him. So I think he never did musical therapy when he was younger, but the music helped him get the words out. So I just want to share.
Oh, that's
Thanks,
wonderful.
Vanessa.
Thank you.
I want to interrupt for a minute. We're going to launch a poll, which is just to ask people a few questions, but we can still talk while the poll is launched. And Beth is going to launch that. Thanks, Beth. So the first one is about the presentation. I believe there's a second one, I'm not sure, just to find out if you're a parent or a professional, but we can talk while people are filling this out. Vanessa, you're saying your son never actually had music therapy though?
No.
It was little, informal music.
Yes. And he had a here when we moved. When my son was 1 year old, we moved to Brazil, where I'm originally from. And we discovered his autism down there and didn't have any access to any type of musical therapy. And he didn't like music on a car. That was the funny thing. We could not put any music on a car except for classical music. It was the funniest thing because we never, used to listen to classic music. But for some reason, I think it calmed him down and he likes the classical music. And so he only had musical therapy when we came back here in school in here. But that was the first language that he start singing. He couldn't tell us full sentence, but he could sing the full song. And I'm like, why can this be possible? But it was. And I think little by little, when we start, I remember Diane, I think, mentioned about making songs with things. Mm-hmm. And I start modify little songs that I knew with things for him to develop the language. And so the music really helped. So it was fantastic.
That's a wonderful story. Yeah.
Right.
Yes.
There's a great story about Mel Tillis, who stutters so much, a country western singer who stutters. And the story goes that he and Merle Haggard were in a hotel room. They were doing a concert together. And so they shared the room, and someone broke into the room and he couldn't say, "There's a burglar in our room." He had to sing it to get it out. And he said, he went in and he says, "Merle, there's a burglar in our room," because he couldn't say it. So I use that with my kids a lot too, that stutters. Nope, let's just sing it.
Yeah, and I think as parents and as professionals, sometimes what happens is that we do this sort of sing song, just like you said, Merle, there's a burglar in our room, or how many of you as parents have sung clean up, everybody, everywhere, right? We do that. And I know I have 2 kids, and for my own kids, it's like, go to the bathroom, go to the bathroom. Does anybody else have this fight? Go to the bathroom. We're leaving, go to the bathroom. And then, all of a sudden it's like everybody's getting frustrated. And so I might just think, go to the bathroom. And it doesn't have to be anything, super fancy. It doesn't have to be Grammy award winning. You don't have to be able to be on American Idol. I always like to tell parents that, it's your voice that your kids are wanting to hear. And so all of a sudden I'm singing about going to the bathroom and it's silly. And, the kids are laughing and they're like, all right, mom, I'll go to the bathroom, and so a lot of times music can bring those emotions up.
That second poll was just to find out what your role is at the session. We have to report parents and professionals and youth. So we have a couple more minutes if people have questions. Otherwise, I want everyone to know, and Courtney, you as well, the link for this will be sent to everyone who registered, whether they came or not. And then the video will also be posted on our YouTube channel. And on the YouTube channel, it can be viewed with multiple subtitle languages. So if you work with a family that speaks a different language, they can access the video and put captioning on in their language. So if you know folks that are interested in learning more about music therapy, please share that with them. Any other remaining questions? Anybody else who hasn't had a chance to talk? David?
Hi, yeah, I'm just curious. I know that the general focus was about in the school, but I'm curious, Courtney, whether you provide services outside the school setting, and also if from the advocacy point, if you're advocating for these services even outside of the school setting, when the school may be difficult to manage and get those done in that manner.
Absolutely. So we definitely see, kids in their home settings. We travel around. I know a lot of music therapists do that as well, or, you might have an office to go to. And I absolutely advocate for that because, as you said, sometimes, unfortunately, and I know I'm preaching to the choir here, that it can be difficult to get the schools to agree to even have an assessment come in. And so absolutely, if it's something where, the parents feel this is something that would be, important for their child, we definitely work in all those different areas. And I've worked with parents to help them to advocate on their child's behalf about what music therapy is. I've provided lots of documentation to districts. So we however it works for the parents. I know sometimes because in Connecticut at this point, we don't accept insurance. Music therapy is not covered under insurance. So that can certainly be something that is prohibitive for parents to be able to pay out of pocket for yet another service. So, I definitely try to work with parents to help them advocate, whether it's in school or, figure out how we can fund this at home, because we have done everything from, we've gotten DDS grants, DCF grants, so there are different ways to provide for music therapy services.
Yeah, I can, and this may be of help for the parents. I actually have a music program that I do with special needs. I'm not a music therapist, but a lot of my clients are able to get funded in New York. I'm in New York, and it's considered a recreation program, a community recreation program. And again, what they have in Connecticut, most of them are doing it through self-direction. So they're able to hire me directly, but that is a way to get at least music services, that may have some of the same benefits as a recreation program and still get the service funded for. So, Anyway.
That's a great idea. Thank you. Yeah, and sometimes what we do also as music therapists is probably a little bit about like what you're doing is we provide adaptive lessons. And so, we know a lot of kids, oh, I want to learn how to play the piano or the guitar. But going through the book, this is Piano Starter Book 1. It's not exciting for them. They only want to learn Sonic the Hedgehog music. And so that's what we do. We present Sonic the Hedgehog music for them in a way that is accessible, that they feel good about themselves, that they can kind of start to learn right away. So I love what you're doing. And I wish that we had some kind of a program like that here in Connecticut. To the best of my knowledge, and we might have other people on the call, there's not really anything like that unless that goes through one of the state agencies.
Yeah.
Annabella, did you want to ask a question?
I was going to say, is there a certain area that you have therapists in or all over Connecticut?
So we work out of Eastern Connecticut within my company. If I get a referral for another part of the state, I certainly refer out to colleagues that I know and trust. And there are a lot of wonderful music therapists in the state that do what I do. So if it's something where you're in a different part of the state, I would be more than happy to give a referral out for the other parts of the state. But we kind of go top to bottom on the eastern part of the state.
Okay, thank you.
So
We have a question.
Yes, Vanessa, thanks. I think one more. Does Husky Medicaid cover music therapy if it's on the IEP? So does the school get to claim or no?
No, the music therapy is not reimbursable by Medicaid anywhere in the United States. And so, yeah, so the school they can get funding from the federal government because it is a related service under IDEA.
So under IDEA.
Mm-hmm. Yeah, so I think that's something as far as, parents go, that's always the roadblock that I hear is that we brought this up and the school says they don't offer music therapy. Well, they might not offer it right now, but if that's what your child needs to learn the best and reach their goals, then that's what they should be. That's what they should be offering. So again, if there's, certainly, Jane has my contact information. If there are any questions about, what we do as music therapists or how, we can help you, I'm certainly, would it be okay if I just put my email in the chat?
Sure.
In case, okay. So let me put that in the chat. And, if you all have any questions or anything like that, you can certainly feel free to give me or CPAC a call or an email. That way, I can, help you work with your situation individually.
Thank you, Courtney. So we're gonna call it a night because it's after 7, or I have just 7. So I really appreciate everyone coming, and you can always communicate with us at cpac@cpacinc.org if you have any different questions. And Vanessa posted our phone number in the chat.
Thank you.
Thank you,
Thank you,
everyone.
everybody.
Have a good night. Thanks, Courtney.
Thank you so much for having me. I appreciate it.
All right. Take
Welcome.
care.
Take care.
Thank you. Jen, I think you have to stop recording.